Thank you so much. Let's be seated. Once again, you're welcome to the 7th Nigeria Family Planning Conference taking place this year, 2022. I would like to appreciate some of the personalities who are right here in our midst this morning. From the Federal Ministry of Health, we have Dr. Lawrence Anyanwu. Please, let's appreciate him. Thank you, sir, for being here. We also have right in our midst our royal father, who is always there with us at every point in time, Sarkin Yaki Gaji. He's the chairman of the BOT, Alhaji Sani Omar Jabi. Welcome, sir. And we have also from the Board of Trustees, Professor Hi, Brian. Good morning and welcome. Well, Hajia Asma Ojoda is ably represented by Amina Bamangar Yahaya from the Center for Women and Adolescent Empowerment, all the way from Adamawa. Thank you for coming. Okay, to set the ball rolling, first let me recognize also the chairman, the man who is cooking the dish that we're eating. Well, not only him, amongst his partners, but he's the chairman for the Association of the Advancement of Family Planning, AAFP. He's the chairman of the LOC and Management Technical Committee also, Dr. Ejike Oji. And I think right away, let's get straight to it. So let's appreciate Dr. Oji as he comes to set the ball rolling with his opening remarks. A round of applause for Dr. Oji.
Good morning, everyone. I want to also specially recognize the leadership of the Federal Ministry of Health that is here with us here. Lawrence Anyanwu, the Director, Reproductive Health, Family Health Desk. You're welcome, sir. I cannot move on without recognizing my able leader, the Chairman, BOT, AFP, Alhaji Sani Umar, Sarkin Yaki Gaji. The man that is turning around Sokoto State and making sure that women have the spaces that they deserve. Please also help me to welcome Professor Brian Adema, a man who has, over the past almost 43 years, has been in the forefront fighting for women's health and women's rights. Professor Adema, you're welcome. Represented here is Amina Bamanga, representing Asma Joda from Adamawa. Unfortunately, she's away doing the work that she loves to do, empowering and creating spaces for women in Adamawa. But to show how much she likes this organization and make sure that everything works, she sent a representative to represent her. You're welcome, ma'am. Also in our midst, we have the representative of UNFPA, Ola Mula, who is being represented here by Dr. Joachim Chijide. Joachim, you're welcome. And behind them is my able co-chair. I call her my Amazon too, Dr. Amina Durai. So, but before I move on, I want to also recognize the Chief of Parties of International Organization, at least I see in the room here. I see our able Chairman of Resource Mobilization, the man that made sure we had enough resources to have this wonderful meeting today. Please help me to welcome Mr. Emmanuel Aja, the Country Director of Mario Stopes International. Also in our midst, the juggernaut, or whatever I will call her, Muriam Ajagu, who is the chair of the technical committee. By 1 a.m., this woman is calling me, Ejike, we haven't done this, Ejike, we haven't done that. Thank you for being who you are. Ladies and gentlemen, let me stop here and we'll keep recognizing people so that we can move in and make sure that we have a very good meeting starting this morning. But let me also welcome very, very warmly our colleagues from the states. You made the greatest sacrifice knowing that we'll have issues of security, but you decided to be here. May I please urge all the people that came from the states, let them stand up, let's applaud them for the wonderful work they are doing in the sub-national area. You're all welcome, ladies and gentlemen. From Somitu, I see you. Ladies and gentlemen, let me just go straight to read the opening remarks of this meeting. I join the Honorable Minister of Health to warmly welcome all our esteemed guests to the opening ceremony, not the opening ceremony, but at least the opening of this meeting. This thing was supposed to be read tomorrow, but at least we'll have to give a background of why we're here today. Family planning is one of the most cost-effective ways of preventing maternal, infant, and child mortality. It has been estimated that meeting women's needs for modern contraceptives will prevent about 1/4 to 1/3 of all maternal deaths. In addition, family planning offers a host of other benefits, as it has been shown to slow the spread of HIV, promote gender equality, reduce poverty, accelerate socioeconomic development, and protect the environment. Just a few months ago, or even weeks ago, there was COP27 in Egypt, which speaks to what we're also saying here. 28 years ago, after the International Conference on Population and Development in Cairo, women are still fighting for their rights. Among women of reproductive age in developing countries, 867 million, representing 57% are in need of contraception because they are sexually active, but they do not want to have a child in the next 2 years. Of these, about 222 million, 26%, do not have access to modern methods of contraception, resulting in significant unmet need. In Nigeria, it's about 19%. In recent years, the global community and many national governments renewed their commitment to family planning. The most ambitious demonstration of this commitment was made at the London Summit on Family Planning in 2012. This gave birth to FP 2020, an initiative to halve the world's unmet needs for contraception and reach additional 120 women and girls with right-based, qualitative, and accessible family planning services by the year 2020. Last year or early this year, it was rebased to 2030. Nigeria was represented at the summit by a team of experts led by the Federal Ministry of Health, who identified the following key steps to ensure the increased uptake of FP services: support advocacy, strengthen accountability, improve supply chains, increase contraceptive supply, promote best practices, and support new innovations. The team of experts included members and partners of the Association for the Advancement of Family Planning, at that time ably led by our father, Professor Oladapo Oladipo, a non-profit, non-governmental advocacy organization with specific interest in family planning. AFP is determined to ensure that every Nigerian has access to family planning information and services as a right and as of quality. Following the London Summit, Nigeria set a modern contraceptive prevalence rate of MCPR of 36%, as a target to be achieved by 2018. This target was subsequently reviewed downwards to 27%, and it was to be attained by 2020. Sadly, despite these efforts, the modern contraceptive prevalence rate has remained low, staying at 12%, while the unmet need is still at 19%. The low utilization of family planning services has contributed to Nigeria's poor maternal and child health outcomes. Exiting maternal mortality ratio of 512 per 100,000 births. That means every day 2 or 3 plane loads of our women crash and die. High total fertility rate of an average of 6 children per woman, which contributes to the rapid population growth rate of 3.2%. That impacts negatively on the country's development and health situations. It was based on the realization that delaying to act will be disastrous, not only to present generation, but also generations to come, that the Nigerian Family Planning Conference was instituted by the Association for the Advancement of Family Planning, formerly the Family Planning Action Group, comprising all stakeholders addressing maternal and child health situation in Nigeria in collaboration with the Federal Ministry of Health. The Nigerian Family Planning Conference is a biannual event that brings together experts, partners, policymakers, and other stakeholders to discuss and share experiences on the progress made and to chart the way forward towards improving the existing situation of family planning in Nigeria. The conference also provides a platform for fostering policy debates, exchange of ideas, and sharing experiences on FP and other reproductive health issues. Let me pause here and share some of the achievements of AFP. In addition to the successful hosting of previous conferences, 6 of them to date, this is the 7th one, and working in close collaboration with the Federal Ministry of Health and other relevant stakeholders, AAP has been able to achieve the following: successfully advocating to government to put money down as counterpart support for FP commodities purchase, increasing the total support to $4 million and to make services free in public sites in Nigeria. Before the advent of AFP, services were not free, and the Nigerian government was not putting any money on the table for counterpart support. AFP, working with the Federal Ministry of Health, made that happen. I think we should deserve a good round of applause. Receiving grants from credible donors, establishing accountability scorecards and FP funding. As we speak, AFP is already developing a scorecard for FP 2030 commitment monitoring in conjunction with PPFN and the UNFPA. Training civil society organizations on tracking and accountability at state level. During the recommitment for FP 2030, the AFP mobilized sub-nationals, about 100 of them, comprising the media, the women groups, the interfaith group, and then civil societies working in the reproductive health space, so that AFP and those groups were part and parcel of making sure the commitment we have right now is the bottom-up approach, unlike the first commitment was top-bottom. Developing deep relationships and partnering with the media to advance the message on family planning. It's on record that AFP has trained a lot of media executives and then also media practitioners and correspondents. Creating a medium of conversation with religious leaders to discuss common grounds for FP services provision in the country, amongst other activities. Yesterday, we had a very successful pre-conference meeting with the interfaith group, and this has been a recurring decimal in all our biannual conferences. Working with civil societies and Federal Ministry of Health to be part of the recommitment of the Nigerian government to set aside, this is landmarking, 1% of the national health budget at the federal level and also the national level, sub-national levels for FP commodity purchase and services. This made Nigeria one of the greatest countries in terms of commitment to FP 2030. Nigeria was the first to make this financial commitment. This year's conference is the 7th in the series and has presented unique opportunities due to the COVID-19 pandemic in terms of lessons learned as it caused tremendous upheaval to health systems around the world, disrupting access to family planning information and services, as well as sexual and reproductive health more broadly. Despite this disruption, the need for family planning keeps increasing as health systems shift to prevent and treat people with COVID-19. It is essential that they also protect access to family planning services. I always say that the Almighty God works in wondrous ways. During COVID-19 disruptions 2 years ago, one of our partners here, and I would like them to stand up for recognition, MSI, actually increased services in their service sites when other sites were recording very low reduction. Please give MSI a good round of applause. And that is what AFP is about, innovation. In place of adversity, we must innovate and we must transform. It is also to pause here to celebrate the world. At Pattaya City in Thailand, a few of us from Nigeria represented Nigeria very well in the International Conference for Family Planning. The Minister of Health led the Nigerian delegation, which was quite significant. The UNFPA celebrated the 8 billion human being that is born on earth. Can we celebrate that? UNFPA said it was time for opportunities, isn't it? The strategic opportunities of that burgeoning population. But you can only make it happen if you invest appropriately. And that's why AFP is now nudging that not just family planning services, we must do other 4 key things to make sure that we invest on our burgeoning population. I think I've underscored it by saying even though we are now 8 billion on earth, it might be a gigantic, catastrophic problem, but we can also turn it to prosperity of immeasurable value. The sub-themes: sustainable financing for family planning, FP 2030 commitments, impactful strategies to strengthen the FP 2030 agenda, family planning localization agenda, expectations and progress, expanding access and quality to family planning through networking and technology in Nigeria, the current situation, expanding partnership and accountability for sustainable development. Just recently, the National Population Commission launched the document they had produced to able to develop plans to implement to the letter the National Population Policy for Sustainable Development that was launched by our president, the first of its kind in sub-Saharan Africa. Family planning programming for youth and adolescents in Nigeria. The children we have delivered to the world, the youth of the world, of Nigeria, are the ones that are going to drive our population to 450 million by 2050. When people like me have stopped procreating, the children we have produced already with the current fertility rates will drive our population to 450 million in 2050. And that's why part of the conference strategy is to make sure that we also get the youth to be part of the pre-conference. 2 days ago, they had a very wonderful youth conference. Let's give them a good round of applause because they are doing things that are wonderful. Interfaith approaches, religion, and social norms. All of us do know that the greatest impediment to family planning services by research have shown that there are 2 things. One is cultural and religious barriers, but the other ones are myths and misconceptions of family planning, should I say, adverse reactions. The conference goal states to increase access to equitable, quality, and innovative family planning information and services in Nigeria. And the main objective of the conference is to conduct stakeholder dialogue and experts discuss on increasing investments, accountability, and access to quality family planning services. Other objectives include to identify new avenues for increased resources for family planning in Nigeria, to share knowledge on the emerging improvements and innovations that support increased access to family planning services, to discuss avenues for sustainable and innovative healthcare provisions and access to family planning, and to expand collaboration on family planning with the universal health coverage agenda. The meeting structure: 3 pre-conferences, youth, interfaith, and women. On Monday, the youth and women had their pre-conferences, and they were quite very, very wonderful. And yesterday, we ended the pre-conferences with the interfaith group. The main conference that is starting today, with the opening ceremony, which is physical and virtual, and some of our colleagues are already logged on through the virtual platform, both in Nigeria and outside the country. There will be plenary sessions. There will be 4 breakout sessions every day. There will be report back to plenary. There will also be a side event tomorrow between 8 and 8:45 by the Pharmaceutical Society of Nigeria, which is outside the normal structure, but you are also invited to be part of that breakout sessions. If nothing else, you have a very good breakfast. There will be wrap-up sessions, and there will be exhibitions and adverts in between sessions. You can see as you're walking in, you can see the exhibition booths. We'll encourage you to visit within the breakout periods. There will be poster presentations also, and there will be side room business roundtable discussions based on LLC prioritizations. These are network opportunities for everybody. If you want to talk in small groups, you want to have a meeting, UNFPA, please salute UNFPA, give them a good round of applause. They've paid for almost every hall here with Jupaigo. UNFPA and Jupaigo made sure that all the rooms are paid for and the meals taken care of. So if you want to have any side event, please contact the LOC. We'll be able to create it for you. The only thing is that if it's outside the meal time, you just provide small chops. There will be definite asks from the government and stakeholders by the end of this meeting. After this, there will be a communique. The 3 pre-conferences developed their communique and we read them. And there will be photo sessions, both physically and virtually, and then the closing ceremony. After that, there will be post-conference activities, post-conference media activities, publishing of the communique, and follow-up team and contact persons in place, so that whatever we discussed and agreed, we must make sure we action them. In the last management committee meeting of the AFP agreed that after this conference, AFP will put all her energies in terms of the last mile concept. We've had wonderful policies, wonderful guidelines, but this is the time to walk our talk. The structure of the conference, the 7th Nigerian Family Planning Conference, promises to be a highly interactive one, allowing for virtual participation through our electronic platform, Drifter. I was so excited and elated. 2 years ago, we used Drifter as our platform. All the meetings, all the conversations we had in 2020, if you go to our website, you can be live and see everything that we discussed 20 years ago. Please, let's thank our IT team, and then also salute DRPC, who funded that Drifter team platform for us. When we went to Pattaya this year, this was the first time the International Conference for Family Planning was using the Drifter platform. So Nigeria is ahead, isn't it? Let's give Nigeria a good round of applause. The conference is expected to attract about 1,000 participants nationally and internationally, and is divided in 2 sessions. We expect to have 300 in persons. But as usual, the last-minute rush. As at the last check, the IT team told us that we have registered 350. And that has made us to upscale our requirements from 300 to 350 to make sure we accommodated everybody. The date, of course, is 12th to 13th of December, 2020, for pre-conferences, and then women and youth and interfaith, Monday to Tuesday, and 14th to 16th, 2022, December, for the main conference, Wednesday to Friday. The official opening ceremony will be tomorrow by 12 p.m., 15th. where we'll expect the dignitaries to be here with us. The duration of the meeting will be 9 to 1 p.m., and 2 p.m. to 5 p.m. daily. Like I said, there will be side meetings, so please keep your eyes open. It will be advertised at the central LED screen every day. Of course, the venue is here, Sandralia Hotel, number 1 Solomon Last Street, Otako, Abuja, Nigeria. For the conference to achieve its goal and potential, there will be plenary and breakout sessions for discussions around submitted abstracts, as well as poster presentations. I think the chairman of the committee, Dr. Muriam Ajagu, told us we have about 99 submissions, 66 of them oral, and the rest will be poster. This conference holding at the end of the 2022 also offers an opportunity for all stakeholders to share experiences on the progress made in Nigeria toward attainment of MCPR of 27%. If we do that, by 2030, we will have gone to the level of 4 children per woman, and that will mean we are actually 4 women per couple, not per woman, and that will mean that we are now at a demographic transition, and the only way to go is prosperity. This conference will be looking at the future, especially now we have renewed our commitments to the world. The government of Nigeria has made a very landmark pronouncement and taking very laudable steps to tackle our growing population, namely the renewed commitment of the AFP 2030 Global Initiative, setting a financial target of 1% of health budget to be set aside for FP, the launch of the strategic plan for the implementation of revised population policy by the National Population Commission, and the setting up of the Population Advisory Group that will continuously advise the National Population Commission, made up of very seasoned population experts and demographers. The most important of all this is the national headcount coming next year. Ladies and gentlemen, you know the last time we had a headcount was 2006. And at that time, we still were 140 million. With the estimated growth rate of 3.2%, that's where we're about 216 million as we speak. But we want data, 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 data. Without data, no life. The launch of the FP 2030 FP agenda would also be in focus to help government to galvanize all stakeholders to meet the target. This is also to thank members of the LOC for their tireless efforts in making sure this conference is a success. May I please humbly ask that all members of the LOC Management Committee of AFP to please stand up for recognition and then applaud them for the wonderful work you did for us to have this great conference. Please stand up, members of the Local Organizing Committee. Joachim, you are one of us. Ladies and gentlemen, these are the juggernauts. These are the people who made this happen. A lot of them are outside here. Dr. Stanley, you are not standing up. You are one of them. Dr. Stanley is the director of DRPC. The RPC has supported us so largely to make sure this event also happened. Thank you very much, and please can you take your seat. In conclusion, while we encourage you to make friends, network freely at this conference, please do take time to navigate our conference website. It's rich, and then you can, on a daily basis, in fact, if you go there, you see what happened in all the 3 pre-conferences, and see for yourselves the informative and beautiful things on display from our partners and exhibitors. Once more, we are honored to have you join us at this conference, and we're all looking forward to a wonderful and fruitful celebration. Thank you all.